Good afternoon. My name is Larry Forsyth. I'm the Senior Manager for WHS and HR Consulting Solutions at Australian Business Consulting and Solutions. Welcome to the webinar. The webinar today is provided by ACCI, the Australian Chamber of Commerce and Industry, and Australian Business Consulting and Solutions. The program has been funded by ACCI through the Federal Department of Education. So I'm very pleased today to bring you three topics in line with our rollout nationally across Australia, this wonderful ACCI-funded project. Today, the three topics that I'm going to share with you are improved recruitment and employee engagement, strategies for staff retention, and improving WHS capabilities. We've got a few slides to get through. I won't be speaking to absolutely every word on every slide, so please, if you bear with me and continue on, that would be absolutely fantastic. So our first topic, improved recruitment and employee engagement. So from a staff turnover perspective, we're seeing that three top reasons people leave their jobs are included on those dash. So the lack of promotional opportunity, poor relationships with managers, and insufficient pay. What I'm also hearing in industry is that someone will leave a bad manager before they'll leave an organisation per se. So from an aged care industry issue perspective, we're seeing that co-workers, and there's a lot of resident aggression. And some of those other issues include wages of registered nurses is 10% lower than acute care nurses, and for those of you that have viewed in, you'll certainly be relating to that. In rural areas, we're also seeing that it can be up to 12 to 13% less from a wage perspective. So in this sense, there's a role conflict because due to the decrease in that we're all wearing many hats these days, many RNs, for example, in the aged care industry are dealing with excessive paperwork. So from a workforce planning perspective, some of the issues include that the turnover rate in the aged care sector at 25% is higher than other sectors. And in this sense, there's also higher training costs for services due to training new staff and retraining, etc. You may or may not be aware, it can be up to $20,000 to bring in a new employee, $20,000 to train them, I suppose you could say. And then if they happen to actually leave the organisation, it costs another $20,000. That's over about a 12-month to 2-year time frame. So it's actually very, very expensive to keep employees. And how do you keep employees? How do you attract, retain, and support them to increase and to ensure productivity? So staff need to be adequately trained, and there's no doubt about that. The delivery of high-quality care to residents and now also families is very prevalent in the aged care sector. From a consulting perspective, we've been certainly fielding inquiries around the National Disability Insurance Scheme and the way that that framework has changed. It's not just that organisations now will need to think about what they deliver on, but what's become particularly important is that customer service delivery as well. Some of those recruitment strategies to ensure that your workforce can stay with you is about improving some of those workplace retention strategies. And that includes particularly induction processes, how you communicate with your people, and looking at how you actually recruit and select right now. So in the aged care sector, due to the many and complex issues that I've identified and shared with you, as well as some of the points there, the additional strategies that need to assist with recruiting and staff industry will be highlighted continuing. So the following strategies are big picture, and they're based on the research from state and federal government perspective. Now, if you don't have job descriptions, then it's something that you seriously need to look at. Everyone needs to have one, and on many occasions we've worked with employers and employees where they actually don't exist. So they are required from a recruitment perspective and a best practice perspective as well. So in that sense, the applicant, the employee can certainly understand the job role and their accountability. So it gives them a little bit of a platform in that sense, and it's in hard copy. It's also important from a learning and development perspective, and we would be suggesting that anywhere between 8 to 12 tasks is ideal to write into the job description. If you don't have a job description, then it's difficult for the person to properly commit to the job itself, and also from an accountability perspective. There's no hard copy for them to be guided upon and how you work with them. And particularly it's hard to performance manage an employee without a job description. When you think about interviewing and selection techniques, there's a couple of stages. So sourcing candidates by advertising or any other methods is something to think about. How are you actually doing it now? So screening potentials using tests and or interviews, and I would be suggesting that you use a range of tools and techniques. Onboarding is very, very important, and sometimes in these economic times when times are tough, if you don't have strong values and behaviours, then there's not a lot to hang your hat on. So I would always be suggesting that as you bring your people on board, as you advertise, then you start to also articulate and espouse your values and behaviours and the mission of the organisation. Some of those strategies and how you might source candidates now and sharing these with you. So from a social network perspective, it certainly improves your reach. Even though initially it may seem a little bit informal, you can certainly start to view that person's skill set, and you can contact them easily in this way as well. What we're seeing from a social networking recruitment perspective is that LinkedIn certainly has, I suppose, the highest percentage of access from a recruitment perspective. And then you can see other social media on that particular slide and how their percentages are sitting. So screening potential candidates is obviously really important, and I would be suggesting a set of verbal and non-verbal interactions and set that up as part of your strategy. And it might be that you informally meet initially after that initial sort of screening and looking for the particular candidate, but then it's very important, and I would be suggesting that you move into a much more formal and structured framework with your recruitment processes. This is really about contemporary and best practice in that sense. So some of the types of interviews are obviously a phone call, that initial screen, a face-to-face interview, obviously with the hiring manager or panel interview, video conferencing, group interview, and that can lead into your behavioural interviewing questions as such. Interviewing techniques will include things like open questions, giving case studies, auditions, simulating scenarios, and asking people to give real life examples, real work examples, obviously very important. We use sometimes the method where we're actually asking people to bring in real world scenarios, and that actually makes much more sense. And in that way, you're really finding out if that person really has the experience and the capability. Once you bring the person on board, it's obviously really important to introduce them to the team. This supports the current cultural fit and can be certainly including things like uniforms, policies, procedures, and code of conduct in that way as well. So some of those strategies for staff retention in aged care provisions, well, what our research tells us is that the Fair Work Ombudsman believes that employers who establish effective performance management systems can reap significant benefits. And in that way, if you've got a harmonious and motivated workforce, then you're one step ahead of the game. Thinking about onboarding and those retention strategies, performance management is absolutely important. And that doesn't mean to say that you're managing performance or underperformance at that early stage. It's just about looking at it from a strategic perspective and then operationalizing it right down to the ground. So effective performance really creates a harmonious and productive workplace, and that's really beneficial for both the organization and the employees. And there must be a framework in place for that. We work with many organizations that don't have this in place, and in that way we're enabling them and supporting them to create that training for their managers. And it's also the responsibility of the organization to ensure that the people on the ground that are going to have their performance reviewed understand what that takes as well and how they can be a part of that. What's really important here too is feedback, and I've created this very simple slide for you. So when you are giving and receiving feedback, and we're not seeing strong frameworks in the aged sector about this, but why don't people ask for feedback? I suppose because in one way they may feel threatened. They don't really want to hear what the feedback is all about. But then you'll always have employees that are very interested. And I always suggest that if there's a framework for feedback, there's a culture of feedback, then it's going to continually improve and support the organisation. So as the slide says, if you can give and receive, you learn, you can act from that, and you can improve the performance. So what is good performance? Well, there's a few dot points for you to take away. It's really about the satisfaction of the employer and that the worker actually gets the job done. My experience over the last probably 25 years and working with many organisations across diverse sectors is that an employee doesn't come to work to do a bad job. And so in that way, if they know that there is actually a structure in place, that they know that there's a culture of good performance and that there are policies and procedures and that they know what's acceptable and isn't acceptable, then that's fair. Some of the reasons for underperformance is that possibly the people aren't actually receiving the feedback. And in that way, it could be a situation where the manager's just leaving the person to continue on, but are they actually giving a simple thank you at the end of the day? There could also be a mismatch between the employee's capability and perhaps the job expectations. And again, that's another really good reason why you should have a job description, a job profile, a position profile, depending on what name you want to give it. Some of the other reasons could be that the employee lacks the skills and knowledge, and that's really for the manager to identify and work with the employee around. It could be a low workplace morale, personal issues, and so on. The last dot point there, workplace bullying, has become very prevalent over the last particularly 12 months with the new anti-bullying laws coming into play. And we're seeing that some of the stats are telling us that 1 in 5 people are actually bullied in the workplace or perceive they're being bullied in the workplace. And this could be connected to underperformance. And so managers and supervisors need to be trained in how to manage that. And policies and procedures need to align that as well. From a best practice perspective, then I would also be suggesting that you need to plan the performance of the employee and the organisation in that sense. And from that perspective, then you can improve the performance, you can provide that feedback and enable that person to move forward and progress. Out of those performance reviews and appraisals, then it enables you as a manager, supervisor and employee to plan the development, and that's talking about learning and development, and it supports problem solving and career planning moving forward as well. And this is what I suggest is best practice within the organisation. The best practice model from the Fair Work Ombudsman's perspective is that you identify the problem, you assess it, you meet with the employee to discuss if there is a problem, and in that way you can jointly devise a solution and monitor that ongoing performance. I'd always be suggesting to managers that it's not just that you are okay about a problem coming to the table from the employee, but you create a culture where the employee also brings a solution and options around that. And in that sense, I think that you'll be able to move forward in a much more accelerated way. But there needs to be a culture around that. So from a best practice model perspective, ensure that you have the facts and it's not subjective judgments, that you cite examples of the poor performance. And I think it's very important to keep notes around that as well. What I find working in industry is that managers and supervisors are not necessarily good at that. And so I always suggest and highly recommend that taking notes. Any inkling that you might get or any feeling of uncomfortability you might have as well, it's very important to write down that it actually happened on that day, and you've got a record of that. You don't want to be in a situation in a week's time, a month's time, or down the track where the employee comes back or that there is some sort of allegation and you haven't got a record of that. And in that way, be precise and selective in what you say and how you say it. So it's very important that you continue to be conscious about your tone of voice and your body language and how you manage and support that employee. So when speaking with the employee, I'd be suggesting that you use a calm and open discussion. Think about your emotional intelligence around that as well and how you regulate that and how aware you are of your emotions. Keep the questions open-ended, reinforce positive things, and acknowledge that employee's strength. That supports a nice culture and it supports the employee as well. Ensure that the employee is aware of the specific tasks of their job, and this can happen from the very, very beginning as part of even the recruitment stage. Obviously, it needs to be highlighted in the position description, and it supports the employee. Everyone needs feedback, and everyone needs to know where they're going, particularly in an organisational concept, and in that way it creates a much better culture and more sustainable and productive workplace. So with this in mind, it's been shown that with employees, they can actually perform better in the job if this communication is open. And in that way, they also understand that if there's any gaps between what they've been doing and what they need to do. So obviously feedback is very important, and I touched on that earlier. But what it creates is that you can, as a manager or supervisor, identify with being empathic, and that's an emotional intelligent element that needs to be considered. I think it's important that if you need to go into detail, well then it may take obviously a longer time frame, and a scheduled appointment may need to be created. But I think it's good to be brief, to be patient, and to be sensitive to where the employee is coming from. And it should be based on past behaviour, not necessarily on the person themselves. And thinking about how you want that employee to work and supporting them to work in that way. So I like the term coined by Marshall Goldsmith, feed forward, and that can be very positive as well. Be specific and avoid general comments, and don't assume. Get the correct information before you give that feedback. So when you're meeting with your employee from a performance appraisal perspective, let the employee explain what the situation is or was. And the idea is that you want to move to a place where you are able to resolve any sort of disagreements. Remembering that you won't always be in a position where you can agree, but you might actually have to agree to disagree. You do want to plan together for the future, agree upon those goals, clarify the details, and remember to remain calm and relaxed, and also encouraging. In this day and age, it might be important to get an interpreter, and I think it's also important to remember that if the employee would like to have support with them, that you're open to that as well. It doesn't mean to say that that support person or mechanism would actually speak for the employee, but they would be there from an emotional support perspective. And of course, thinking about jargon, talking about the issue, not the person. And at the end, it's important to summarize and check for understanding and to gain agreement in that sense as well. I would be suggesting to you, don't discuss personalities, don't skirt around criticism. If someone wants to give you that feedback, it's about not being judgmental and assessing it in a rational and emotional way. I know at times we do compare to others within the workforce. If you can avoid that, it would be a suggestion of mine. You don't want it to be vexatious. You don't want to nitpick as such. I mean, collusion happens in all organizations. Managers talk to managers about employees. Employees talk to employees about their managers. It actually happens. So it's important to be aware of that, and you don't want to be in a position where you bring up unrelated issues that certainly have been resolved in the past or previously. Thinking about termination of employment, there really is just one or two slides on this, and what you need to be careful around is that the circumstances must not be harsh, unjust, or unreasonable. I know with my experience, and I recall working in the aged care sector in the past, and probably collectively around about 6 years experience in that sector. And I recall one incident where a supervisor told one of their workers that because they were late, they mustn't like working at the organisation or within the team. This was considered really unfair, and it did go all the way to the commission, and it was found that the way that the supervisor had spoken to the employees, it didn't empower them at all, and in fact it had a lot more detail to it, but this is not the sort of thing that I would be suggesting how you speak to your employees. It might be the case, and you might think that, but I think it needs to be discussed in a much fairer way than that. So fair treatment is important, and reasonable treatment is ultimately important as well. So thinking about termination, employees must have worked for businesses for more than 12 months to make an unfair dismissal claim. And with this in mind, I would be saying to you and suggesting that as a supervisor and manager, again, to record and make sure that you've got those recordings in hard copy and on file, because you wouldn't want to be in a position where if it went to a tribunal and came all the way back to you, that you didn't have evidence of continuing to collect that information. So you need an evidence trail in that perspective, and you need the support from HR around that as well if you've never done this before, and that would be fair and reasonable to ask for that support. Moving on to learning and development, well, in the aged care sector, it's not just your technical learning, it's about leadership training, supervisor and communication training. What we're working with now is particularly from an aged care perspective around leadership, customer service, and so this could possibly be classified as the soft skills, being the harder skills, your technical training as such. But to be a good leader, it's about that if you don't have that knowledge, then you need to learn about that and how you supervise people. And what I'm talking about there is people management as well. So suggestions to improve learning and development. It's important to create a positive work environment. You want to seek full contribution from your staff, and that's about consulting with them about the sort of training that they think that they may need, and that may come from your customer satisfaction surveys or your in-house surveys. It's important to promote flexible rostering, and also if someone is studying, and in that sense it could be a situation where they may receive financial assistance to cover some of those costs. I would also be suggesting to promote a variety of learning and development courses, and in that way it's not just face-to-face, it could be some e-learning courses, and there's many of those out there in this day and age. Moving now to improving WHS capability for aged care providers. Well, WHS is the responsibility of everyone if you weren't thinking about that or you weren't aware. So under the new WHS Act 2011, there are responsibilities for the PCBU, the person conducting a business or undertaking. Ultimately, this person or particular position is the most culpable. And we also highly suggest that policies and procedures align that behaviour. There's also responsibilities for officers within the organisation, and it's not just a full-time employee, for example. It's about your part-time people, your contractors, and your subcontractors as well. So everyone has a responsibility here. Some of the duties of officers is that it can be any person who can make or participate in making decisions that affect the whole or substantial part of the business or the corporation. And so think about, have your officers been identified? And if you haven't, then you may need to talk to me a little bit more about that. With this, we can make an assessment of what you currently have in place. We can identify your gaps, and we can report that back to you. And in that way, you can create your operational and or your strategic WHS implementation plan. Some of those workers' responsibilities for employees, contractors and subcontractors, it's very important to have robust contractor frameworks in place, and I'm talking there about professional indemnity and public liability. And in that sense, all of these workers must take reasonable care around health and safety. And that conduct wouldn't want to adversely affect others, so they must follow instructions so far as reasonably able to, and they must cooperate with your policies and procedures. Even today, when we talk to people within industry and in aged care, these are some of the gaps that they have, their policies and procedures around how they actually bring on board contractors. So the PCBU role, they must ensure that as far as reasonably practicable, the health and safety of workers and their engagement, or how are they caused to be engaged, and that they are responsible for those people overall. Again, it's about that robust framework and those robust policies and procedures right across the board, not just for contractors, but for all workers. Workers whose activities are carried out internally or externally, and in that way they need to be directed. And so it's very important that anyone undertaking work for the business, within the business, needs to be overseen by the PCBU and making sure that, again, those policies and procedures are sound. Other persons in that way by the PCBU ultimately having the management of that not put at risk from the work carried out. And in that way, you can assure that it's a sustainable environment and it's productive from a WHS perspective as well. The effects of poor work health and safety directly impact on the quality of resident care in aged care. And this has a negative impact on staff engagement. And some of those dot points you'll certainly relate to. So if you don't have a sound structure for health and safety, it can decrease morale. It can decrease productivity as well. And when you think about culture, it's not something that just happens overnight. It takes a long time to change, and sometimes those embedded behaviours will be something that you need to take into consideration. Some of that as well includes higher absenteeism, staff turnover. I mean, people want to come to work and know that they are safe. They want to be in an environment where there's zero harm, and that's about looking after themselves, their colleagues, and of course your customers. In that sense, if it's not in place, then there could be higher costs, and there could also be more time spent on recruitment and training with that staff turnover. Obviously, it's important, and I can't emphasize this enough, to have strong policy and how you train your people, and part of that implementation. So a framework for implementing safety starts with the appropriate policies and procedures. And again, consultation and risk management strategies are essential. And so thinking about how do you currently manage your risks in your workplace, and can you classify them into high, moderate, and low risks. Obviously, implementation can be the most challenging. In this day and age, we're all working more with more hats. We're working in leaner environments, and it's hard to find good staff. But it's important that you think about the process of putting that decision forward, and how will your policy affect the situation, and are people aware of the policy, and are they following the procedures? So I'd be suggesting that training is obviously very, very important here. It may be a case, particularly in aged care, where aged care providers can't always afford to pay their people the top amounts of money, but if they're training their staff and they're nurturing their staff, well, then that's certainly something of value as a proposition to the employee and to keep them on board. So just emphasizing the training perspective, and it's very important when you think of aged care to look at manual handling. And we are working with aged care sector. We implement annual manual handling training, and that's something very, very serious in this industry, and we're seeing a lot of injuries come from that. So it's important to be proactive around that. So put your programs together, just demonstrate the desired behaviour, instruct the person, inform them, and coaching and guiding them is obviously important as well. Consultation, well, why is this important? Well, under the law, it's required that organisations set up mechanisms for WHS consultation. It's not just about that managers go ahead and do it, but ask the employee what they think as well, and record that. Make sure that you've got WHS as an agenda item, if not on the top agenda item on your meeting minutes. How do you do that? Well, you get your health and safety reps involved. You actually set up very formal safety committees. There doesn't have to be training for that committee per se. We do support organisations around that. And then any other sorts of training, i.e. toolbox sessions, staff meetings. And I would be suggesting that you record that information as well. Staff notice boards and those sorts of things where you can actually pin up that meeting minute so that people can read all about those. And having designated notice board for health and safety would certainly be something that I would be suggesting. From a risk management perspective, well, some of those hazards, and I think that you relate to this, include physical, chemical, ergonomic, and so on. And so how do you manage those in your workplace right now? I would be highly suggesting that you have a risk management register and you include formal documentation in your register, and we can support you around that if you don't have that in place right now. Hazards too, obviously very, very important, and some specific hazards relevant to the aged care sector are hazardous manual tasks, obviously moving and washing patients, pushing trolleys, bed making. And this is something that goes on all day, every day. So it's very important that people are trained in how to do this and that they're recorded, or that training is recorded as such. The psychological issues too, that longer term impact and how people are treated, and then some of that resident aggression that we've seen coming through and doesn't go away when you think of dementia and or unfamiliar surroundings. The WHS Act 2011 defines health as both physical and psychological health, and the duty to ensure, as far as reasonably practicable, that health and safety extends to ensuring the emotional and mental health of workers is ultimately important, particularly when we think of the prevalence now of mental health in the workplace, and we're seeing some of the research coming through that 1 in 5 people in Australian organisations will have a mental health issue. And in that way, we're running mental health workshops for our members and non-members, and so aged care sector can certainly be involved in that. Some of the return on investment with that is that we're seeing that every dollar spent, there's at least a $2.50 return on investment, and even doubling in some sectors. So some of that cause of psychological hazard, the 3 broad categories include position related, so the work environment, tight time frames, high input, working alone, role ambiguity, and we're hoping that that doesn't exist in your facility. And insufficient feedback. I can't emphasize that enough. Everyone, whether they're asking for it or not, actually does like to get feedback. And in that way, it links to that, as I said earlier, people don't come to work to do a bad job, but they do like to receive positive and constructive feedback. Preventing some of those psychological claims, thinking about the following points. So be aware of burnout and fatigue and stress. Establish policies. Deal with the effects of aggression. Provide team and management support. Provide access to debriefing and counselling services. Carry out ongoing monitoring. And review aggressive incidents. Make sure you record these as well. Obviously, getting sleep, exercise, nutrition, and being aware of your emotional state is very, very important in support of preventing psychological claims. In the end, how do you know that staff are getting the WHS message? This is a question that we're often asked. And we would be suggesting that measures of success would include that the most urgent hazards have been addressed, increased number of hazards are reported, and again, this can be in your hazard register. Employees involved in all workplace inspections, particularly within that particular unit. Increased employee input into the solutions for hazard, and that's that solution-focused outcome and culture that you want to create and set up. And increased level of interest and involvement of staff. In most organisations, there's always a naysayer. Sometimes we spend 80% of the time on that person trying to micromanage them. But I think it's about focusing on possibly just the 20% of your high performers, and in that way, lead by the front, be a role model, and walk the walk. It's about that you want to manage your people and make sure that they're healthy and safe. Monitoring and auditing for systematic change is about continuous improvement and thinking about lead and lag indicators. And what I would be suggesting is demonstrate improvement in positive or preventative WHS activity, and record that and demonstrate that and share that. And some of those lag indicators might demonstrate a failure or negative outcome, but that's okay. It's about how you can improve and continually improve. Both need to be recorded and shown. Improving WHS productivity is ultimately important, and so by measuring your performance and addressing your risks, productivity gains will be made, as will performance issues, retention strategies, and how you can actually be more productive in your workplace. So what we've covered is improvement, recruitment and employee engagement, some strategies for staff retention, and how improving WHS capabilities can enable your organisation to be more productive. I know that I may not have gone into as much detail as you would have preferred. We are running face-to-face sessions with this funding by ACCI across Australia. We're running more of the programs and webinars next year. So please tune in again or pass the word on if you've attended today, as other colleagues within the aged care sector may be very interested in reading the slides coming to one of the sessions. So thank you very much for your attendance. I greatly appreciate it, and I thank ACCI and the Australian Business Consulting and Solutions. If you wish to discuss further and you needed further support in potentially enabling greater productivity within your workforce around recruitment, staff retention or health and safety, then I would be very happy to discuss that with you. And you can contact me through the normal channels of the New South Wales Business Chamber. So finally, thank you and good afternoon.